Coming up on Mayo Clinic Q&A.
If we didn't have great ICU colleagues and great hospitalist colleagues, our patients would suffer.
As emergency departments continue to deal with COVID cases, a new problem is emerging.
We are seeing patients with mental health needs that are significant. It's really heart-wrenching to see patients who are struggling as people try to cope with some of the loneliness.
Welcome to Mayo Clinic Q&A. I'm Dr. Sanj Kakar. We've just passed the 1-year mark since the first case of COVID-19 was diagnosed in the United States, and one group that has been on the front lines fighting the pandemic are those within emergency medicine. A year into the fight, it's time to take a look back at what we've learned and how those on the front lines are handling the ongoing pandemic. Joining us to discuss this today is Mayo Clinic Professor of Emergency Medicine, Dr. Annie Sadosty. Welcome back to the program, Dr. Sadosty.
Good morning, Dr. Kakar. It's great to be here.
So you were on the program last April. And so, we were just sort of going through the ramp up of seeing cases across the country and in Rochester as well. How have things changed for you and your colleagues in the emergency room?
Well, I have to say, I was reflecting on a year and the difference a year makes. A year ago, I was watching with anxiety and anticipation our colleagues in Asia and Italy struggling with this new infectious disease about which we knew very little. And the nature of the disease was such that we could predict that it was coming. As much as we didn't want to believe that to be true, we could predict that it would be here. And that was unsettling for sure. So we were reading and we were watching the world stage of healthcare and listening to our colleagues across the globe as we tried to prepare intellectually for this new entity and prepare our processes because we believed that we would be seeing cases soon. So that was a year ago today. And things are very different now because, as you know, COVID-19 has hit every nook and cranny with rare exception of the world. And we're feeling less anxiety about the disease because now there's confidence because we've cared for many patients. And so it's a different place, very different. And yet I will say that it's been very hard, a lot of work, and a lot of emotional toll taking care of people who have suffered from this disease. So the difference a year makes for sure.
Did you see the waves? Like when we were talking in April, it was sort of ramping up, and then we went through the spring, the summer, the fall, and now we're through the winter. Have you seen it sort of fluctuate, the number of cases?
Definitely. If we wind back the clock to April, we were talking at the time or around that time about kind of profiling patients based on their travel history, for example. We would screen patients at our front triage desk for, have you traveled to Asia? And then it changed, have you traveled to Europe? And have you traveled? It was this constantly evolving set of questions. And the clinical syndrome was constantly evolving. So we were regularly checking what is today's definition of COVID-19 from a syndromic standpoint. It didn't start out that we were looking for people who had lost taste or smell, for example. Diarrhea got added. So it was really initially cough and fever and chills and myalgias. And then we kept adding on pieces of the disease as we began to understand the disease. So it's been an interesting ride. I will say one of my colleagues said, in the middle of kind of one of these difficult waves, like, because it is tiring, to be very honest with you. Throwing on PPE for literally almost every patient encounter is tiring. And showering after every shift is tiring. So the emotional toll is significant. But one of my colleagues looked at me and said, you know, as tiring and difficult as this has been, I wouldn't want to be anywhere else. And I think all of us feel that way. This was, in emergency medicine, a specialty designed to take of anyone, anywhere, anytime, the safety net of healthcare. To sit on the sideline, if you will, for our Super Bowl wouldn't have felt right. So it really is a privilege to have helped patients through this. And it hasn't been easy. The post-Thanksgiving wave was formidable. Things are a little bit better now, but we have seen the disease ebb and flow based on a variety of factors, whether patients are inside or outside, people are congregating inside or outside, whether people are congregating or not. I hope the vaccine gives tremendous hope that our future state will be better than our current state. I certainly am counting on that. But yeah, we've seen waves, and some have been more difficult than others. And Thanksgiving, the post-Thanksgiving wave was really challenging.
Yeah, take us back to the post-Thanksgiving wave. As you said, it was formidable. Tell us what you had seen on how things had changed on a daily basis 2-3 weeks after Thanksgiving.
So this is a disease that impacts the entire healthcare system. So the hospitals were really full of patients because the sickest patients get funneled to the hospitals with the teams and special capabilities, the advanced capabilities that some of our sickest of the sick require, like ECMO or kind of extreme intensive care, if you will. And we have that in our healthcare systems across our geographies. And so my colleagues across Florida, Arizona, the Midwest, were seeing large numbers of patients from our communities. Plus, the hospital was full of patients who had been referred in from the local and regional geographies for that extreme intensive care, if you will. So when I would be seeing a patient from Rochester, Minnesota, our community, perhaps a neighbor, and then trying to admit the patient to the hospital was full and our teams were busy. So admitting a patient became challenging because the hospitals were so full. So the whole system was impacted by that surge, if you will. And then the healthcare teams were part of the communities. And so teammates, if you will, my colleagues, my physician colleagues, the residents, the nurse practitioners, PAs, the nurses, the allied health staff, were also getting COVID because the prevalence of disease was so high. And so we were being impacted on many angles, and the teams were winnowing down to kind of those who were well and could work. And we were being asked to cover shifts because they can't go uncovered in our specialty. And so everyone was doing everything we could to stay healthy. And then if we happened not to be healthy, to pitch in to cover for colleagues who were ill.
I'm glad you mentioned
or ill with perhaps COVID, because the syndrome is so broad that people would be taken out of work for possible COVID as we waited for the test to see if they could come back to work. So it's been an interesting ride all around.
I'm glad you mentioned that about the staff in the emergency room. I mean, people need to know that it's not just physicians or nurses. There are so many people that work in the emergency room really as a team to take care of the sick at their hour of need. And so, and that runs from the janitors all the way across the spectrum of healthcare workers in the emergency room. So you alluded to some people contracting coronavirus, not coming in because of their health. How have people been emotionally as well as physically?
Well, I think that the post Thanksgiving surge tested people for sure. I mean, I have tremendous colleagues, absolutely amazing people. And yet we're human. And so you need the opportunity to recharge, and make no mistake about it. I missed seeing my family over Thanksgiving holiday. It is our tradition to gather as a family for Thanksgiving. With my sister and her family and my parents, and that didn't happen, and that was hard to begin with. And then when you layer on extremely busy shifts and illness call outs where you're working more than you thought you were, which I was happy to do to cover colleagues who were who were ill with or without COVID. It does wear on you, and that's just me. So if you add that to the very big team with whom I work, you can see how it got a little dicey. And that's just the honest to God's truth. And yet we showed up every day and tried to put a smile on as we put on a yellow smock and safety glasses and a mask and a helmet or face shield and gloves and hand sanitize in and out multiple times. I mean, for every encounter, which is many. So it wears on you. But I think that in general, like the waves, we're in a little bit better spot. And I remain very hopeful that the vaccine brings promise, and that we can get successful immunization plans, and that there is a brighter tomorrow. And there's great things about today. I don't want to imply that they're not. I mean, there are wonderful things about today, even in our changed version of today. I think it's important that we don't forget the great things that are happening around us, because that plays in, I think, to people's resilience. And if we can find the positive in the today, it helps us survive the difficult tomorrow. So.
Well, thank you. I can honestly say that as a physician and also as a member of the public. If it wasn't for you and your colleagues in the emergency room, we have so much debt and gratitude to you. Now, one thing, in the middle of the winter, you traditionally have flu season and a lot of cases and people coming in with the flu. Now, with masking and social distancing, etc., what have you seen in terms of patients coming in with the flu? Have you seen a downtick in that?
So I'm not exaggerating. This is 100% true. We swab for influenza and COVID-19 in all of the patients who present with a COVID-like syndrome. Okay, so I do a lot of swabs every day. I'm not joking. I have seen, are you ready for this? 0 cases of flu this year.
Wow.
It's unbelievable. And I thought you'd ask this question, so I checked the Mayo Clinic microbe watch yesterday. Do you know how many cases we've seen? Like 0. It's just unbelievable that we're not seeing influenza right now. Unbelievable. But it's believable because it's a disease that's transmitted through respiratory droplets and handshakes and many of the same things that we're guarding against so fiercely with COVID-19. So it's predictable, and yet it's noteworthy because right now we would be inundated with influenza on a normal winter. I mean, extreme, and there's the other respiratory illness I looked at on the microbe watch is RSV, which is a kind of upper respiratory tract illness that we often see in kids. We're not seeing that either. So masking has made a difference in terms of obviously COVID-19, but also other diseases that are transmitted in similar ways. And hand sanitizing, obviously, that's made a big difference too.
I mean, that's amazing, not only for healthcare resources, but as people may have forgotten, the significant morbidity and mortality with influenza that you see in every winter. So that's been a huge sort of area of fortune with what you've just said, with masking, social distancing, hand sanitizer, etc.
Definitely. I mean, it's just such a difference, a stark difference.
Now, when we spoke in April, one of your fears were that patients who had real illness, for example, a stroke, a heart attack, patients having symptoms who traditionally would come to the emergency room were not coming because of COVID-19. Have you seen that trend change such that these patients are coming in, are having access to healthcare?
Yes, that was a very real issue in April when we met. The emergency departments were eerily quiet, and diseases like appendicitis and strokes and heart attacks, they're not going to stop because we're having a pandemic. And we were very concerned that patients were avoiding emergency care to their detriment because of the fear of contracting COVID-19. And that was a very real concern. That wasn't a paranoia. It did bear out as we looked at the data. I would say, having not looked at the data, I don't want to speak as an authority on this, the more recent data, but certainly the clinical days reflect that our patients with acute illness like stroke, heart attacks, appendicitis are back in the emergency department. What's different, I would say, still, and I think that this could be there are nice byproducts of external forces that create change. And I think the telehealth video visits are here to stay in a wonderful way. Patients can, on their device through a portal, access healthcare and get advice from their providers, physicians, nurse practitioners, PAs. And we're not seeing simple things in the emergency department. So I would say that our acuity has risen. The emergency department is caring for patients with emergencies who cannot be cared for in other venues. And so we're seeing patients who attempted to engage with telehealth or the COVID nurse line or alternate forms of the healthcare system who are being referred in. And that's the way a smart system should work. And so I actually hope that this continues and appreciate that we have adjusted for the times. And our patients expect immediacy. They get it in every other industry. With a few keystrokes, you can order toilet paper online, for example. And so because of that, we as a nation have gotten used to that immediacy. And I think that this will be a lasting part of the pandemic in a wonderful way.
Yeah, I think you're absolutely right, especially with telehealth, not only just in the emergency room, but I think across the practice in general. I think patients appreciate it, as you said, the access to healthcare in a safe way. What else do you think is here to stay? You mentioned telehealth. What else do you think is likely to stay?
Well, I do feel that, as much as I absolutely hate to admit it, I think this little thing could be here to stay for flu season. It's certainly here to stay for the here and now. But the evidence is fairly compelling that we as healthcare workforce will be exposed to less influenza if we're wearing masks, for example. So I bet that there will be some degree of masking that is lasting. I don't want to imply that it'll be in every venue like the grocery store forever. That's not my statement. But I do think that we as a healthcare workforce will use the masks to our advantage to try to minimize healthcare associated infections for our employees and staff, and then to also encourage our patients to stay safe. So that's one thing. I think hand sanitization, I have teenage boys, and there's hand sanitizer in my son's car. There's hand sanitizer in nearly every pocket. And I think that we, as a population, are attentive to that in a way that we most likely weren't about a year ago. So I bet that'll stay, and I think that's a good thing. So those are two things that I think are here to stay. And then there's something that I'll just share with you. You didn't ask this question, but I'm going to tell you anyway. I will say one thing that is a little different than April, and I didn't answer this earlier when you asked, but I think it's an important thing to at least bring up. We are seeing patients with mental health needs that are significant right now. And it's really heart-wrenching to see patients who are struggling emotionally and with substance abuse issues. There was a recent New York Times article about a school system in the Las Vegas area where there had been 18 suicides in like school-age kids since the onset of school. So between then and December. And I can tell you, because I practice both in the pediatric emergency department and the adult emergency department, that we're seeing just substance abuse issues have really escalated with the pandemic. I think as people try to cope with some of the loneliness that has been a byproduct of isolation, and then the kids are really struggling. And so those are two issues that we are going to have to grapple with as a country in order to have our population be healthy and safe. And that is really hard to see. Another thing that's also quite difficult is some of the health inequities, which I think are probably worth its own session. But I will tell you that certain populations are struggling more than others as it relates to COVID-19. And so whether that's people of certain ethnicities or socioeconomic status, or patients with mental health or substance abuse issues, that's another kind of really difficult thing to watch, because when I see them, they've hit a level of crisis that is hard to watch. So there are bright spots for sure. I'm vaccinated. I've had both vaccines because I'm fortunate to have been one of the first wave people. And it does bring, I will tell you, it does bring this, nothing has changed. I wear a mask everywhere, in the grocery store, at work. So nothing's changed in terms of my willingness to let my guard down, if you will. But it has been a psychological uplifter. I don't even think that's a word, but I made it up, for me. The vaccine, it's funny, I'm someone who gets a little bit of injection site pain and haven't always loved, I'm vaccinated, but I haven't always loved to get vaccines. And this one was different. I feel a little invincible, though nothing's changed in terms of my protection, but I do feel safer. And I hope that the vaccine rollout can get to our patients and my parents and my extended family, because when that happens, I think that we will really move forward as a world. So.
Yeah, I concur with your sentiments completely with the vaccination. It's amazing what modern day science has been able to do. And thank you for bringing up about the mental health crisis and the inequities that exist in the healthcare system. I only think through experts like yourself, by raising this, will this truly be acknowledged and action taken. One thing I wanted to ask you is, we're hearing about new strains coming from the United Kingdom, South Africa, and Brazil. How is, with that data coming through, how has that put up the antenna even more in the emergency room with patients coming through the front door?
Well, right now, I will say that the new strains, it's almost like as it relates to the new strains, we're watching, we're learning, we're waiting to see what the science kind of brings us. So we're almost in a new wave of science and understanding. So it's a little bit like Groundhog Day, if you want to think about it that way. I'm almost back a year ago learning about new aspects of COVID-19 now. What does this new strain mean? How long does your immunity last after vaccination? Like, there are questions we don't know the answers to. So I feel like we are living the science as it's emerging and adjusting. So if I had to say one of the hallmarks of living through a pandemic with an emerging infection that is changing, and we are changing because of our ability to treat it and the science that we're learning about it, is that we have to be flexible and we have to continue to learn and evolve as the science emerges. So I think that there's not been a boring day with COVID-19, and I will say that with complete sincerity. There's not been a boring day at all.
Anything else you'd like to add?
No, I really, first of all, thank you very much for having me on the program. It was a nice opportunity for me to reflect on the difference a year makes. So I think sometimes reflection brings gratitude, and it can be centering. So it was really a nice opportunity for me, Dr. Kakar, to be on the show again. And I think that my final words really should be, we are a healthcare system full of remarkable people. And I mean that. It is, if it weren't for the janitors doing their great work and the nurses doing their great work and our NPPA colleagues doing their great work and the resident trainees doing their great work, I mean, it's just, we as physicians wouldn't be able to do our great work. And so I want people to know that while emergency medicine has at times had a spotlight on us, if we didn't have great ICU colleagues and great hospitalist colleagues, our patients would suffer. And so this disease has really shone a bright light on the entire healthcare system. And I extend similar gratitude to people like you and my wonderful colleagues, multidisciplinary colleagues across the country and the world, because to be very honest, our colleagues in Asia and Italy really got us started on the right foot as it relates to learning about this disease. So it's been a humbling experience to be a part, and I couldn't agree more with my colleague who said that as hard as it has been at times, I wouldn't want to be anywhere else.
We've been discussing emergency medicine's role in the battle against the COVID-19 pandemic. Thanks to Mayo Clinic Professor of Emergency Medicine, Dr. Anna Sadosty. Thanks so much for all your help and expertise in this area, Dr. Sadosty.
Mayo Clinic Q&A is a production of the Mayo Clinic News Network and is available wherever you get and subscribe to your favorite podcasts. To see a list of all Mayo Clinic podcasts, visit newsnetwork.mayoclinic.org. Then click on Podcasts. Thanks for listening, and be well. We hope you'll offer a review of this and other episodes when the option is available. Comments and questions can also be sent to Mayo Clinic News Network at mayo.edu.